Okay, members, we are going to take up business on the daily file. We're going to begin with our concurrence item, file item number 1. We will pass and retain. On reconsideration, file items 2 through 4, all items shall be continued. That brings us to the Assembly third reading file. File items 5 and 6, we will pass and retain on those. Senate third reading file items 7 through 9, we will pass and retain on file items 7 and 8. That brings us to file item number 9, SB 106, by Senator Laird, presented by Assemblymember Gabriel, with amendments by Assemblymember Tangipa. The clerk will read with amendments.
Senate Bill 106 with amendments by Assemblymember Tangipa.
Assemblymember Tangipa, you are recognized on the amendments.
Thank you, Mr. Speaker. Today I rise in opposition to SB 106, and I offer these amendments because I believe in providing comprehensive health care for all women, not just some. When voting on these amendments, ask yourself this one question. Why does Planned Parenthood get a $90 million grant, but right now over 60 hospitals in the state of California are on the verge of shutting down, and they have to ask for a hospital distress loan? Hospitals across our state that deliver high-quality care to women are on the brink of closure. Today, 1 in 5 of our hospitals is at risk of shutting its door. Between the low Medi-Cal reimbursement rates and the high cost of required seismic renovations, many hospitals are struggling just to keep services available. These are comprehensive Medi-Cal services that nonprofits simply can't and don't provide. In Madera County right now, women must travel outside their county just to give birth. Despite a nonprofit operating an office there, this is not true access to care. Let me reiterate that. In the county that I represent, there is not a single labor and delivery services available. A woman who lives in Madera County cannot have a baby in one of the largest counties in the state of California. We should be focused on ensuring comprehensive medical care for every woman, everywhere, not directing limited resources in a way that leaves communities behind. Additionally, under the original text of SB 106, we would be funneling millions of dollars to a nonprofit with little to no transparency. At a time when it feels like every week brings another case of corruption or misuse of public funds, we should be moving towards greater accountability, not away from it. Colleagues, I respectfully ask for your support of these amendments to ensure access to quality medical care for all women across the entire state of California.
Thank you, Assemblymember Tangipa. Madam Majority Leader, you are recognized.
I move to lay the amendments on the table.
Seconded by Assemblymember Ortega. Members, this motion is not debatable. It takes a majority of those present and voting. This is a procedural vote. Clerk will open the roll. All members vote who desire to vote. The Majority Leader is asking for an aye vote. Assemblymember Tangipa is asking for a no vote. All members vote who desire to vote. All members vote who desire to vote. Clerk will close the roll and tally the votes. Ayes 41, noes 13. The amendments are laid on the table. Clerk will now read on the bill.
Senate Bill 106 by Senator Laird, an act relating to the state budget and making an appropriation therefore to take effect immediately. Budget bill.
Assemblymember Gabriel, you are recognized.
Thank you very much, Mr. Speaker. I rise to present SB 106, which will provide essential funding to support women's health care and family planning services to communities across California. Most importantly, this bill will backfill $90 million in federal funding that has been stripped away from community clinics that offer abortion services. It is important, colleagues, to be blunt about what is going on here. President Trump and congressional Republicans have specifically and intentionally defunded Planned Parenthood as part of their broader attack on reproductive freedom and abortion rights. This calculated attack will have devastating consequences for communities across California, both in terms of reproductive freedom as well as access to basic health care. Under such circumstances, California cannot and will not stand idly by. Despite our budget challenges, we must step up to defend Planned Parenthood, to defend reproductive freedom, to defend abortion rights, and to defend access to health care for women and families across California. In short, while the president is attacking California communities, we are standing up to defend them. While more work remains ahead, this funding is essential to support services such as contraception, family planning, cancer screening, and so much more. And I want to take a moment and thank our incredible Women's Caucus led by our Majority Leader, the Chair of the Budget Subcommittee on Health, the Health Policy Committee Chair, the Chair of the Select Committee on Reproductive Health, and so many others who have fought tirelessly to defend Planned Parenthood and protect our communities. And so on behalf of communities across the state of California, I respectfully request your aye vote on SB 106.
Thank you, Assemblymember Gabriel. Assemblymember Johnson, you are recognized.
Thank you, Mr. Speaker. I rise in strong opposition of SB 106 today. As a member of the Budget Subcommittee, I am deeply troubled by the lack of transparency surrounding this bill. We have not had one single public hearing, yet we are being asked to approve $90 million in taxpayer funds. That alone should give all of us, every member in this room, pause. California expects us to operate in open and to earn their trust, not to evade their scrutiny. From a policy standpoint, the concerns only deepen. This bill provides $90 million in grants to so-called reproductive care providers while explicitly exempting those funds from basic accountability. There's no public input, no meaningful oversight, and no clarity that I can see on which organizations receive the money or how it will be spent. At a time when fraud and misuse and public funds are being uncovered across our state, this approach undermines confidence in our government. Back home, my constituents are asking why we can find $90 million without hearings for this, while families struggle with the cost of living pressures, public safety needs, and infrastructure demands. As a legislator, I cannot support a bill written in the dark. As a taxpayer, I cannot support spending without accountability. But as a conservative, I cannot support funding abortion providers with public dollars. We can and must do better. I respectfully ask for your no vote on SB 106.
Thank you, Assemblymember Johnson. Assemblymember Sharp-Collins, you are recognized.
Thank you, Speaker and members. Let me open up by acknowledging Happy Black History Month. I rise on behalf of the Women's Caucus. I rise in support of SB 106, which is the continued funding for Planned Parenthood, because this debate is about more than a line item in a budget. It is about who controls the health decisions, whose lives we value, and whether access to care depends on your zip code, your income, or your identity. I've served on the San Diego board of Planned Parenthood, and I have seen firsthand what this organization means in the lives of so many patients. For millions of people, Planned Parenthood is not a backup option. It is their primary source of care, meaning it's their only option. It is where they go for cancer screenings, they go for birth control, they go for STI testing and treatment, annual exams, and for honest, medically accurate information about their health. The attacks on Planned Parenthood are often framed as a political or ideological, but the actual world impact is deeply personal and profoundly unequal. When funding is threatened, the people who feel it first and the worst are always those who were already faced with the greatest barriers around them, many of the greatest barriers to care. Low-income patients, people of color, Black people, immigrants, young people, LGBTQIA+ individuals, rural communities with few or no other providers. Health inequities in this country did not happen by accident, and they will not be solved by accident. They are the result of policy choices. Choosing to fund Planned Parenthood is a decision to close gaps in care, to invest in prevention, and to make sure that basic health services are not a luxury reserved for those with wealth or privilege. Let us also be clear about the defunding, actually what defunding really actually does. It does not reduce the need for the reproductive or preventive health care. It does not make people stop needing cancer screenings or birth control or STI treatment. It simply makes that care harder for folks to access. It causes a lot more delays and more expensive in the long run, which leads to the worst healthcare outcomes and higher public costs, especially in the communities that are already underserved. We should be moving in the opposite direction instead of continue to roll backwards. We should be expanding access to trusted providers, strengthening the healthcare safety net, and ensuring that patients can make decisions about their own bodies It's my body, it's my right, without political interference. Healthcare should be guided by medical evidence and patients' needs, not by ideology. During my time on the San Diego's Planned Parenthood board, I saw an organization that is accountable. They are medically rigorous and deeply committed to treating every patient with dignity, style, class, and pride. Providers and staff show up every single day, even in the face of harassment and political attacks, because they believe everyone deserves quality care, no matter who they are and how much money they have in their pockets. So supporting this funding means we are serious about health equity. It means that we understand what reproductive health is truly about. And it means that we are willing to stand with our patients, our families, and our communities instead of turning our backs on them for political gain. I am proud to support Planned Parenthood and the essential care that it currently provides. And I respectfully ask for your aye vote on SB 106.
Thank you, Assemblymember Sharp-Collins. Assemblymember Gibson, you are recognized.
Thank you very much, Mr. Speaker and members. First of all, let me just simply say I rise in support of SB 106, and also thank the author from the Senate for bringing this bill forward, and thank my colleague from the San Fernando Valley. So I represent a big portion of South Central Los Angeles, and these services are absolutely needed. We're talking about legislation that provides $90 million of one-time only funding to ensure clinics that can keep their doors open and continue to provide service for millions of Californians in the state of California. And again, I want to underscore, we would not be in this position if it wasn't for this one big, ugly, disastrous bill that was provided by the White House and Republicans in Congress that disregards and continuously disrespect our community, especially our vulnerable communities. We would not be in this position. And so my colleague asked and talked about why are we doing this when hospitals are closing. Well, we know why we're in this position, and I don't know why he would even ask the question, why are we doing this? We're doing this because we care for our community. We care about our community, especially communities of color. And obviously, Washington, D.C. continuously get it wrong time and time again. But damn it, we're going to stand up and we're going to protect Californians and those, especially our women. And we know that Planned Parenthood provides the much vital needed services. And my colleague has already articulated that it does more than just reproductive services. And if we don't do it, then what's going to happen is we're going to have more people dying, underscore dying, in our community. And that's not something that we want to have on our conscience. So that's why we're going to stand up with moral dignity and fight on behalf of the people that we represent, because it's our responsibility. And that's why we were elected. We were elected to stand up for those who cannot stand up for themselves, those who've been left out, those who've been left for dead. And we're going to do that. And today is an opportunity for those who have the moral fortitude to stand up for those individuals that we took an oath and to swear to stand up for. And we're going to continue to do that, even in the midst of the bullies and those who can't do it, who have the moral courage to do it in Washington, D.C. The cowards who won't do it in Washington, D.C. And we're going to stand up, because that's what makes California, California. That's the reason why we took the office. That's the reason why I ran for public office, to stand up for those who can't stand up for themselves. And damn it, we're going to do it. So we're going to do it unapologetically. The $90 million is a drop in the bucket to support Planned Parenthood, to provide the vital needed services for the women folk who needs it. And the people in my district absolutely need it. So I respectfully ask for a strong aye vote. And let's do the right thing for people.
Thank you, Assemblymember Gibson. Assemblymember Ahrens, you are recognized.
Thank you, Mr. Speaker. Good afternoon, colleagues. I'd like to rise in strong support for SB 106 and urge all of my colleagues to join me in voting yes to maintain critical access to health care services for all Californians. I work very closely with my colleagues in this chamber in a bipartisan fashion, and I think most of us do too. But what is happening in Washington, D.C. under Donald Trump and congressional Republicans is wrong, and it hurts all of our constituents, regardless of where you live or what your political affiliation is. Trump's big, ugly budget slashed more than $120 billion over 10 years from health care, putting all of us at risk in our communities. From tribal communities to residents in Madera to residents in Santa Clara County, hospitals and clinics will close because of this federal budget. Clinics are already closing, and even more clinics and hospitals are going to continue to close because of Trump's big, ugly budget. And why does the big, ugly budget specifically target Planned Parenthood? We must put a stop to Donald Trump and congressional Republicans' attack on women's health care. We will pass this bill today to protect health care access for all Californians, and I hope you will all join me in supporting that. And lastly, why is Donald Trump and Pam Bondi continuing to block millions of files in the Epstein files? And why do they continue to redact wealthy names? All victims deserve to know the truth of what is happening, and I urge an aye vote for SB 106.
Thank you, Assemblymember Ahrens. Assemblymember DeMaio, you are recognized.
Thank you, Mr. Speaker. Bringing you back on topic to SB 106. Let me start out by saying I'm a Republican who firmly believes in personal freedom. As a gay Republican, as a pro-choice Republican, government ought to be out of our lives, out of our bedroom, out of our pocketbook. California voters share those beliefs. We are a live and let live state. No matter where you stand on the issue of abortion, it's a profoundly personal decision. Not something for government to be involved in any significant way. It's between you, your family, and your faith. But let's be clear. This isn't about choice or access to abortion services. The language in this bill is written in such a way that one single politically connected supporter receives $90 million with an extraordinary lack of oversight, audit, and financial responsibility. Why? Why are we doing this? Why for this specific group? I don't think it has anything to do with women's health care services. Because if you cared about women's health care services, you wouldn't be backfilling $90 million that the federal government so-called shortchanged California. No. Last week you had an opportunity to backfill $2.5 billion to provide women with health care services. You chose not to. In fact, I went through the entire record of the budget, and this is the first backfill action this legislature has taken. You have not backfilled any other federal reductions except for one politically connected group, Planned Parenthood. I got my hands on a poll that was done on your side of the aisle from FM3, I'm sure you all saw it, that said that public corruption has skyrocketed up in the minds of California voters as a concern. It's almost as high as cost of living, and we know you haven't given very much relief to Californians on that. But corruption, the use of taxpayer funds for political purposes, to reward campaign contributors and backers, to waste on fraud, the public is worried about what are we spending their money on. I must only question whether the testimony by the Planned Parenthood executive director in favor of Proposition 50 played into today's action. Is this a reward for a campaign support? Because that's what it looks like to me, and I believe that's what it's going to look like to many Californians. Now, do not try to pretend that this has anything to do with women's health care. My colleague from the Central Valley offered a very common sense amendment to make sure that this $90 million of funding would go to health care providers without lobbying and political activity. And in fact, in that amendment, my colleague from Central Valley said, let's make sure that none of this money appropriated in SB 106 goes to any political activity. But no, you don't want that oversight. You shot down that common sense amendment. So sure, you'll try to pretend like this has anything to do with choice or abortion or women's health care. But I believe anyone paying attention will realize it's nothing more than a reward for a politically powerful group. I urge a no vote.
Thank you, Assemblymember DeMaio. Assemblymember McKinnon, you are recognized.
Good morning, Mr. Speaker. I rise to support SB 106. Why $90 million for Planned Parenthood? This is about access to basic health care. Planned Parenthood provides primary and preventative care, cancer screening, STI testing, and treatment, contraception, parental care, and gender-affirming care. For many patients, especially low-income women and communities of color, Planned Parenthood is their only health care provider. As the federal government and red states strip reproductive freedoms, California has chosen to be a reproductive freedom state. This commitment requires real investment, not just rhetoric. California has seen significant increase in out-of-state patients seeking care here. Clinics are facing higher costs for security, staffing, and compliance amid escalating threats and harassment. The $90 million ensures clinics stay open, staffed, and safe. Preventative care reduces unintended pregnancies, emergency room visits, and late-stage cancer treatments. Every dollar invested in reproductive and preventative care avoids for higher downstream public costs. Multi-year uncertainty has left providers scrambling. $90 million provides predictability, allowing clinics to plan, retain, staff, and expand care where it's needed. The bottom line, if California is serious about protecting reproductive freedoms, women's health, and women's health equity, then we must fund the providers doing the work. This $90 million investment ensures Planned Parenthood can keep its door open, protect patient access, and deliver life-saving care, especially as the federal government protections erode. And for my friends across the aisle, I am so glad to hear you guys talk about accountability, because I haven't heard you stand up one time and talk about any accountability when it comes to the Washington budget. We haven't talked about the president declaring war on other countries without Congress, or cutting funding from other states without Congress. And so I am so proud to hear you guys talk about accountability, and I look forward to you calling out your president and asking him for accountability. Thank you.
Thank you, Assemblymember McKinnon. Assemblymember Krell, you are recognized.
Thank you, Mr. Speaker. Good afternoon, colleagues. I had the honor of serving as Chief Legal Counsel to Planned Parenthood the first time President Trump was in office. And I can tell you that cuts like this, efforts to defund, result in clinics closing across the country and worse health outcomes for everyone, not just for people seeking abortion, but all patients who are seeking care. We've seen it all across the country. This defund started to be implemented back in September of 2025, but even before that, we saw an erosion throughout America of reproductive health care. This is a coordinated attack on women's rights by the Republicans in power, and this is just one more huge step forward in that multi-year long effort. But here in California, we have done everything we can to protect access to health care. We passed Proposition 1 to guarantee the right to choose in our California Constitution, but we all know that rights are only good when we have access to them. This $90 million fund by SB 106 will guarantee that no more Planned Parenthood health centers close in California. What this means is the 25,000 patients who seek care at a Planned Parenthood every single week will continue to be able to get their care, whether that's pregnancy testing, whether that's STI testing and treatment, whether that's cervical cancer screenings, whether that's men seeking vasectomies, whether that's sexual assault survivors going for help, whether that's human trafficking survivors going to have someone to talk to, whether that is even primary care, which is given at some Planned Parenthood clinics, as well as behavioral health services. This is a wide range of care that helps a wide variety of people. And 80% of those patients happen to be Medi-Cal recipients. The big, beautiful bill, H.R. 1, specifically targeted Planned Parenthood. That's why the $90 million specifically for Planned Parenthood is so important. There is no other health entity with the unique structure that Planned Parenthood has, and that was deliberately targeted in the language of H.R. 1. I'm so grateful for my colleagues for bringing this important bill forward. I urge everybody to support SB 106 because literally thousands of California patients' lives are depending on it. Thank you.
Thank you, Assemblymember Krell. Assemblymember Patterson, you are recognized.
Great, thank you, Mr. Speaker. For the last couple years, I've had the opportunity to serve on the Budget Committee, including the Budget Committee overseeing our healthcare in California. And every single hearing, we have a line of people out the door concerned about cuts proposed by Governor Newsom and approved eventually by this legislature. That's not the man in Washington, D.C. That's individuals on this assembly floor that have made the decisions to make cuts to critical programs for California's healthcare. That includes decades long of underpaying providers who do Medi-Cal services in California. For the poorest of people in California, the people that are the most needy, why don't they get the same attention as Planned Parenthood? That includes dental. That includes individuals with disability, which this governor of our state just last year proposed cutting preschool programs for kids with disabilities. But those preschool kids didn't have a lobbyist representing them to get their issue directly to the floor like Planned Parenthood does. I'm just curious why this item right now is coming to the assembly floor when all these individuals, and I hope everybody gets an opportunity to come to a budget committee hearing on health care. I believe Mr. Speaker has invited anybody on the budget committee to go to any budget subcommittee, and I hope you take up that offer to come to the healthcare one, because you will see every single hearing lines and lines of people lined up to speak in opposition to cuts that were proposed by this governor and will be approved most likely by this legislature. And by the way, it happened before H.R. 1. This was last year. These are individuals coming in last year to express their concerns about budget cuts that this legislature made. So I would like to, I oppose this resolution because I don't think that Planned Parenthood should get more attention than the disabled kids that we all represent. With that, I respectfully ask for a no vote.
Thank you, Assemblymember Patterson. Assemblymember Bonta, you are recognized.
Thank you, Mr. Speaker and members. I rise in support of SB 106 in a moment where the federal administration is dismantling and defunding access to health care. California is choosing to step up. Let's be clear, these funds are only needed because of the federal government's decision to prioritize billionaires over essential health services in the big ugly bill. As health chair, I've heard from stakeholders across the state about the impacts of health centers like Planned Parenthood closing. Home to 109 Planned Parenthood health centers that provide over 1.3 million patient visits a year, 25,000 patients a week go to Planned Parenthood to receive their essential reproductive health care services.
That's in every single county in this great state of California. Recently, Planned Parenthood Miramonte had to already close 5 health centers, sunset 3 services, and laid off 15% of its workforce in South San Francisco, Madera, San Mateo, Santa Cruz, and Gilroy. We just simply cannot afford to continue to let this happen. Because what happens when these Planned Parenthood centers close is that the entire system is left to be able to figure out how to provide care. Our healthcare clinics that are already overburdened will not be able to sustain that. Our ERs will see more people needing care because of the acute care that they need because they avoided preventative care. Our providers will not have the ability to provide that care. And by the way, Planned Parenthood has a majority of the people who receive Medi-Cal services receiving service through their care. So we are talking about the same individuals. I want to be clear. SB 106 is payment for healthcare services provided in Medi-Cal to eligible patients. Note that when HR 1 passed and Planned Parenthood was defunded, these costs were not able to be recovered by Planned Parenthood. Normally, costs that would have been paid for and claims that would have been reimbursed. This was a direct attack on Planned Parenthood, on women, on our reproductive health, and our ability to ensure that we provide preventative care. This funding is a literal lifeline to many. I mean a literal lifeline. Because women across this country, and certainly in the state of California, are going to be not receiving the care that they need. Breast cancer screenings, cervical cancer screenings, screenings for STIs that lead to cancer and increased harm to their bodies. We're talking about life and death here. With that, I respectfully request your aye vote.
Assemblymember Bonta. Madam Majority Leader, you are recognized.